Initiation of antiretroviral therapy in early asymptomatic HIV infection. Human immunodeficiency virus or HIV. It's a virus that gradually attacks the immune system. It makes it harder to fight off infections and disease. The virus destroys a type of white blood cell called a T helper cell and makes copies of itself inside them. The T helper cells are also referred as CD4 cells. The virus is found in body fluids of an infected person. AIDS, or acquired immune deficiency syndrome, is a syndrome caused by the HIV virus, and it develops when the HIV infection is very advanced. There is no current cure, and following initial infection, a person may not notice any symptoms or may experience a brief period of influenza-like illness. The symptoms.
Hi, I'm Dr. Justin Sim from Dr. Tan & Partners. In this video, we are going to talk about the signs and symptoms of HIV. HIV symptoms vary depending on the individual and stage of disease. Within the first 2 to 4 weeks after initial infection, people may experience flu-like symptoms, which they describe as the worst flu ever. This is known as acute retroviral syndrome or ARS. Symptoms include fever, swollen glands, sore throat, rash, fatigue, body pains, and headache. Symptoms can last between several days to several weeks. Please remember that these symptoms are seen in other common conditions, and you shouldn't assume you have HIV just because you experience them. Also note that many people with early HIV infection show no symptoms. After this early stage of HIV infection, the disease enters a clinical latency stage, where the virus is developing in the body, but no symptoms are seen. Should you happen to be on treatment for HIV, the virus is often kept under control, and you may experience a symptom-free period that can last decades. If you have HIV and are not on treatment, then it will progress to AIDS. You may experience severe symptoms, including rapid weight loss, recurring fever, profuse night sweats, extreme tiredness, swollen glands, diarrhea, mouth sores, lung infections, and neurological disorders. If you experience the previously mentioned symptoms, it is impossible to confirm HIV unless you get tested. Thank you for watching. I'm Dr. Justin Sim from Dr. Tan & Partners. For more information on this and other useful health tips, please visit our website at www.drtanandpartners.com.
Treatment. Rates of HIV-associated complications and death increase as the number of these cells in peripheral blood declines. It has been general practice to defer the initiation of antiretroviral therapy in asymptomatic patients with a CD4+ count above a certain threshold level. It is important to establish whether it is safe and beneficial to initiate antiretroviral therapy in asymptomatic patients who have a CD4+ count that is much higher than 350 cells per cubic millimeter. Method of treatment. It was randomly assigned patients to receive immediate antiretroviral therapy. Drugs that were primarily used were tenofovir, emtricitabine, and efavirenz. Average CD4+ cell count increased markedly during the first year and continued to gradually increase thereafter. The effects of immediate antiretroviral therapy on AIDS and no-AIDS events were seen in reductions of rates of tuberculosis, sarcoma, and malignant lymphoma. Pros and cons. The pros would have that it increased a risk of CD4 plus cells, unscheduled hospitalizations, and the rate of bacterial infections was significantly reduced, and no increased rate of adverse effects associated with this strategy. The cons: AIDS progression occurred in some patients. The conclusion: antiretroviral therapy should be recommended for patients in whom HIV has been diagnosed regardless of the CD4 plus count, and antiretroviral therapy reduces the risk of sexual transmission of HIV.